Hi guys, welcome once again to the Travelers YouTube channel. As you know, my name is Abdul. Today I want to run you through how it feels like in working within a hospital or the NHS and working in a care home. That is something that people have been trying to know more about, and as in the differences and the similarities, the pros and cons involved in working within a hospital setting and working in a care home or a nursing home. So that is what I want us to look at. So we'll be looking at the shift pattern, we'll look at the nature of work, we'll look at the, of course, salaries, we'll look at the benefits that each side comes with. We'll look at some of the advantages and disadvantages involved. We'll look at career progression. We'll look at chances of you furthering your education. So let's just take a quick breather and we get to business. All right, so what you have to get clear or is that there is a difference between working for the NHS. So the NHS is the biggest healthcare provider in the United Kingdom, and that is solely government backing or government sponsored. So there is a difference between working in the NHS or working in the government sector and working in the private sector. That is not what we are going to look at. We are going to look at working in a hospital setting and working in a nursing home. Bear in mind that there are some nursing homes which are government owned, though we have most of them being private owned, but we have government owned care homes. So we're going to look at residential homes or care homes. That is also a different topic. So basically, residential homes are being manned by experienced or trained care workers or care assistants. They don't necessarily don't need a qualified nurse to man these places, but with the nursing homes, then you need a qualified nurse to man that. So that's a quick difference between the residential homes and the nursing homes. So let's get straight to the point. NHS, as I said, biggest healthcare provider in the UK with numerous hospitals and numerous trusts spread across the UK. First on the list, before you could work as a nurse in either a care home or the NHS, then you need to register with NMC UK. You need to have a PIN, you need to be qualified before you could work in either places. And just if you are trained here in the UK, then you have the option traced after school to either decide to work in the NHS or in a hospital or work in a care home. If you are being recruited from overseas, be it from Africa, from Asia, from the Caribbean, from Europe, wherever you are being recruited from and come here to the UK, then you also have the choice to either go to the hospital or work in the nursing home. First on the list, let's look at the shift pattern. So usually the flexibility. I think nursing homes are more flexible in terms of the shift pattern than NHS, because NHS usually you run the 12-hour or the 11-hour or 11.5-hour shifts. Okay, you can't lead the long days. It's the same in the nursing homes, but there are some nursing homes that would allow you work 9 to 5 for 5 days instead of working for three long days in a week or 4 long days in a week. You just do 9 to 5 for 5 days and you rest for 2 days. Though there are some NHS trusts or hospitals that also have that flexibility. So that is with the shift pattern. So there's no much difference when it comes to that. Now the nature of work. Usually when you are in the NHS, NHS setting is it's usually a very large place where you have people from various disciplines coming together. So there is this interprofessional, teamwork where you have people from various neurology department, from mental health, from ops and gynae, from pediatrics coming together, people from the diagnostic imaging department, from the lab, you have the doctors for various specialties, the gynecologist, the psychiatrist, the entomologist, the optician. All of them are on site and readily available in case you need them or you need their services. It's more of they're all centered at one place, whereas it's not this the same cannot be said for the nursing homes, because usually nursing homes you have nurses running their homes, and when there is an emergency, then the nurse on duty has to give the immediate life support of the basic life support, because before you call the doctor responsible, or because before you calling the ambulance for or calling for extra help. But getting that help within the hospital setting is quite easier and quite quick, so it makes lessen the risks you tend to face. That is one. Then also, with the number of patients you work around, one thing with the hospitals is that at times you go on a shift and you allocate about 5, 6, 7, 8 patients a day, and you will be the allocated nurse, especially in the hospitals. Hospitals that have bad staffing, you will be allocated to 12, 11. It happens where you have to take care of them in a day. Tomorrow you come, you could be allocated to a different patient. But in the nursing care homes, usually you are dealing with mostly old age. Okay, so ideally people who have studied gerontology or geriatric nursing, your patients are mostly people who have advanced in age, people with dementia, people with on palliative care, people on end of life, illnesses that you need to take care of. So you tend to almost each and every day you are with them, you tend to have the opportunity to give a holistic care, because you tend to monitor their progress for quite a long time. Okay, because they tend to spend more time or more days in the nursing care homes, whereas in the hospital you could look after someone in just in a day, and tomorrow you go for a shift and the person has been transferred to a different facility or different department for further management. So that is another aspect of it. And in the hospital, again, you tend to see a lot of cases, ranging from acute emergency cases, you see chronic cases, you see all sorts of medical conditions, whereas the kind of conditions you see in the nursing homes are somehow limited and are not conditions that demand immediate or emergency care. So another thing is that in the hospitals you tend to sharpen your nursing skills by working around various equipment. Okay, sophisticated equipment are readily available for you to use, which always keeps your nursing skills sharpened. But that cannot be said in the nursing home, as I indicated, because mostly we are dealing with old age and people who are a bit stable and do not need immediate or immediate life support. So that is it with the scope of work and how usually your work around that each side is. So with the nursing homes, it's more flexible, and a bit relaxing, and risk is minimal compared to the hospital. Also, look at your career progression. In either places, it depends on you. There are nursing homes that are very limited. It depends on the company that you're working with or working under. There are companies who man like 10, 20, 30 care homes within the UK, so they are big. And there are others that are, man only 2 or 3 care homes. And with your career progression in the nursing homes, you could progress to become a home manager. Okay, you can become a home manager. As on the hospital, you can rise to become a ward manager. In the nursing home, you can rise to become a home manager, where if you work well and you tend to work for a bigger company, you will become even a regional lead or a regional manager, where you have to run or manage multiple nursing homes, maybe 1 or 2. So you become more of a director or a boss, and you can rise through this rank very quickly because you tend to have a limited number of staff compared to the NHS, where there are a lot of people in line that even when a position is being advertised for, be it a charge nurse, a deputy ward manager, or manager, you have to compete with a lot of people before you can get there. But in both sides there is career progression, but there is more career growth in the NHS compared to the nursing home. That is what you have to have in mind. And also with education, to be honest, furthering your education in the NHS is much easier because most NHS trusts are linked to hospitals. They have university hospitals that have their own trust, and you can easily be studying or enrolled in a course whilst you are working, and you tend to rise through the educational ladder very fast. Whereas in the nursing home, it depends on your manager, it depends on the type of company you are working with, and as to whether there are funds readily available for them to invest in you. I'm not saying nursing homes don't cater for your education or don't support you for your education. If you have the resources, fine, you can do it on your own, they support you. But if you want them to support you in doing that, it's not something easy to come by. Also, let's look at their annual leave. So usually in the NHS or in the hospitals, you can have up to 2-3 weeks, 1 month continuous annual leaves, where in the nursing home you can have more than that. So in both sides, you have the chance to go on annual leave whilst you are being paid. But when it comes to maternity leave, then NHS has a upper hand, where you'll be given 6 months of annual leave. Whilst you are home, you'll be paid and you get the government funding or payment as well. Whereas some nursing homes, especially the private ones, will give you maternity leave but will not give you up to the 6 months. Whereas we have some care homes that give the 6 months. I told you we have care homes which are being operated by the government. So if you happen to find yourself in this kind of care home, there shouldn't be a problem with them sponsoring or giving you maternity leave up to 6 months with pay. So you have to weigh the two options. Then we look at the salary, which is one of the critical areas people look at. So I'm speaking for band 5 as a newly qualified or as a overseeing nurse here, starting at band 5. NHS, usually you can record from anything from the hourly rates, from 11.0 upwards. So you can earn 11.0, 11.5, 12, some places 13 an hour. Okay, but in the care homes it starts from 12, 13, 14, 15, 16, 17, 18 pounds per hour. Yeah, so the salary you earn in the nursing homes are much more and better than salaries that you earn in the hospital. Though you might think in the hospital you work more, but the nursing homes are paying quite more. And also with overtime, NHS usually you can do up to 48 hours of overtime, where you have to take mandatory rest. You need to rest. Yeah, but in nursing homes, usually there's staff shortage, and they tend to, you can work up to 60 hours of overtime, provided you are, healthy, and your health declaration indicates that you don't have any underlying condition and you can work. They don't have any problem with that, you can work. Also, let's look at sick pay in NHS. When you are sick, the number of days that you are sick, you don't go to work, you still get paid. Yeah, I think in nursing homes there is a limit to that. You'll be paid, but not for a very long time during your absence. So basically, these are some pros and cons. In either way, it's a personal decision. For me, I think it's a personal decision, because whether career progression you want to earn, it's all about how hard you work. That will determine how much you earn in both places. As I indicated, these are the pros and cons, and each of them have areas where they are slightly ahead of each other, and there are areas that there are no much difference. So I think this will help you to make an informed decision. And one very good thing that you have to keep in mind is that at any point in time, if you want to switch in between, you can. From NHS you want to go to a nursing home, it's easy. From a nursing home you want to switch to a hospital, it's easy. So you can throw your shot, you can try your best, and your luck, and you can taste both waters and see how deep they are and how fast and easy you can swim in both tides. So that is it for you to make an informed choice. Thank you very much for watching. Kindly subscribe, like, share the video with your friends, and if this is the first time you're watching me, kindly subscribe. If you are with me since day one, thank you very much. There are more interesting videos coming your way. I'll be doing a video on the living expenses in the United Kingdom. Thank you very much. To see you next time. Bye.